Hello everybody, this is Joey G with more Vampyr. Continuing off pretty much exactly where we ended the last episode. Going to be more positive, even though it's been exactly like 2 minutes. Oh! Fresh blood! Hello! I don't like being in that small corridor. Hi! At least we're getting plenty. I don't like how that did close. Okay. That way get some blood so we can have a nice resolve. And we'll just... I don't like that door opening and closing. Yeah, right now, being an old morgue is scaring me a little. Let's see. Yeah, I'm even shivering a little bit. Like, damn. Sanitary? No. Remove blood citizens. I'm sorry, really? Still surprised. Hello, Dolphy. I'm
Finally,
back.
you've returned, Doctor. Did you find anything of value?
Yes, nurse.
You've worked your first miracle, Doctor. Now, this patient here needs immediate treatment.
Duty calls. When the storm has passed, I'll show you how to mix the remedy yourself with the same basic ingredients.
Many thanks, Doctor. When you've finished, you ought to report to Dr. Swansea in his office. He's been looking for you. Seemed pressing.
Diseases. Okay.
I'm alright. Don't waste your time with me.
Good evening. I'm Dr. Reed.
Hello.
Can I help at all?
No,
Really? Why are you here then?
I don't want to talk. My throat hurts too much.
I suppose that this pain is the reason you're here. Is someone taking care of you?
Yes. And no.
Could you at least tell me your name, sir?
Mortimer. Mortimer Goswick.
Okay.
I have to go now, sir.
I'm alright. Don't waste your time with me.
Okay. I thought I would...
It's my son.
I'm Dr. Jonathan.
I'm Beatrice.
Goodbye. Good
Wait,
evening,
I'm
Mr.
confused. Am I supposed to...
Do you need any help?
I'm afraid I'm...
Oh, here
You
we
are not
go.
a burden, sir. Healing
Okay.
you is my responsibility.
And you have my gratitude for that.
Okay,
I have to go now, sir.
I'm alright. Don't waste your time with me.
but we did help him, right?
Good evening, Miss.
I'm okay.
This hospital seems to be falling apart.
Okay.
Do you need any help?
Thank you, Doctor.
To give you the benefit of the doubt.
I have to...
I'm all right. Don't waste your time with me.
Madam?
Good evening, Doctor.
What do you think of your reception here?
Any complaint?
Any complaints?
Reception?
I have had the uttermost reservations about
Is there something in particular that's bothering you?
Some of the staff were not especially welcoming. I suspect they're
here we
not
go.
accustomed to dealing with patients of such social standing.
Okay. It'll
Tell
get
me
much.
more about your arrival at the Pembroke Hospital. What gave you such a bad first impression?
The ambulance driver was quite rude, for a start. And that nurse, Miss Hawkins, seems to have quite a dubious attitude.
What do you mean?
She managed to secure a bed for my son despite the epidemic. It was a relief, but it wasn't cheap.
She charged
Charge
for
you?
a bed.
Okay.
Yes, and I paid without question, considering the urgency of the situation.
I share your concern, Mrs. Goswick. Be sure that I'll talk to the people involved.
I don't expect compensation, Dr. Reed.
Okay.
But I'm aware such behavior would not be tolerated in other hospitals.
Goodbye, Mrs.
Okay. So pretty much you use your money to buy a bed in here. Okay. Okay, now you're complaining. Oh, yeah, you know, right? You know, just you know, like it's such a shame. Like, really? So you're using money to buy your son a fucking bed, and then you bitch just because people are not nice to you. That, you know, your son shouldn't even be in that hospital right now. Like, in other hospitals, what do you know? It's a pandemic of the Spanish flu of 1918. Going to kill 3 times more people. I did learn that. I thought it was 20 million. It's 30 million. Don't know if I mentioned that yet, but yeah, that's a freaking lot of people died to a pandemic. Oh, is this the office? Okay, yes it is. We found the office.
Please, Jonathan, come in. Fascinating, is it not? In the last decade, so many mysteries have been brought to light with our microscopes.
Nice.
The human body, biology's penultimate
skull.
frontier. The more we explore its boundaries, the less we're able to trace a clear line between life and death. You, my friend, have a foot in both countries. The view must be vertiginous.
It's at least as vertiginous as chatting about vampires with you, I would say.
This must be all so new to you. This area of town, the hospital, a brand new life. How stimulating it must be.
I wish I could share your enthusiasm, Dr. Swansea, but my condition defies scientific categorization. Undead? Unalive? Immortality defies logic.
Oh.
I cannot express my thrill at this serendipitous turn of events.
Huh?
The world's most eminent specialist in blood transfusions, a vampire. One might say a gift from heaven.
There is an absurd poetry to my situation.
Yeah.
Physician, heal thyself.
Yeah, that is
Forgive me.
true.
I've been an admirer of your work for a long time, and now you are so much more than a brilliant physician. And please, call me Edgar.
Edgar.
There is no need to apologize, Edgar. You offered me sanctuary when I had none.
Yeah.
Very well. I have a task for you, Jonathan. Something that will require all your newfound skills.
Please, go on.
The Pembroke only survives through the generosity of our benefactors.
Oh, jeez.
Unfortunately, our main donor has found herself in a bit of a bind. Now, if you could help her out...
A spokesman or politician is what you need. That's not my calling. And until I come to understand what has happened to me, I require discretion.
Discretion is in order, Jonathan. Lady Ashbury has recently received rather indelicate correspondence that, if revealed, would jeopardize her position.
And you would like me to eradicate this
Ooh.
threat?
By the stole, of course not. I would just like you to pay her a visit. Her ladyship is certainly near the tents outside, tending the sick. You can't miss her. Look for someone impossibly delicate.
Accepted. I'll see what kind of trouble Lady Ashbury is in.
A rat? Cool. It not better not be for one we were just talking to. Oh no, it's outside. Okay, I like that. Whew. Yeah, like again, I don't like when people I understand your son is important, but like, what about the other people's sons and daughters, husbands and daughters and wives who have died?
The flu took my dear wife, Emily.
Oh no.
I take comfort knowing we'll soon be together again.
Mr. Rainfield, that's no way to talk. You're in good hands here, and we'll be up again soon enough.
Yeah. Oh no.
Now do me a
No
kindness
pillow.
and get some sleep. I'll be back round later.
Your words are kind, the blessings of an angel. You're the sweet, sweet lady of mercy.
Good evening, Dr. Reed. It's a pleasure to see you again.
Oh wow.
You seem surprised. Dr. Swansea has brought me up to speed concerning your recent appointment
Yeah.
to Pembroke Hospital.
Yeah.
You're a vamp. The lady who saved me that night, before vanishing into thin air.
Oh, nice.
I remember you from the pub with Dr. Swansea.
Indeed. Allow me to introduce myself formally this time. My name is Lady Ashbury.
Ashbury.
I remember you well, in spite of the brevity of our encounter.
Apologies. You've taken me by surprise.
Yeah, now
I'm
we can
very
get some
happy to see you.
answers.
The pleasure is mine.
I feel like you can be a total.
Doctor.
Yeah, you can be a total
I
dick.
hope
I
you're
think,
more
like,
disposed to answer my questions now.
but before
You must
that,
have countless questions, but our rather urgent matter first. Swansea has explained. My cover, if you prefer, has been compromised.
oh no. Yeah,
Dr. Swansea
what
has
be nice
commissioned
and
me
do
to
it.
be your agent in this matter. You could start by explaining what's amiss.
These past insufferable weeks, I've been the victim of extortion.
Oh wow.
I've made a first payment, but the blackmailer grows greedy.
Like normal.
I must refuse his most recent demands.
Is it
Who
vampire?
would be so foolish as to threaten you? A kindred spirit.
Even if it were the case, and I highly doubt it, a vampire would have asked for something more valuable than money. My suspicions lean toward a patient or their family.
Oh, yeah. That really
Please
makes
continue.
sense.
Every detail is essential. I'm your man.
My embarrassment in this matter is eclipsed only by my shame at having put the hospital at risk. The threat from our anonymous scoundrel is clear. A list of dates. My visits coinciding with the dates of suspicious patient deaths due to massive blood loss.
Oh my.
I'll take care of it. Do you know where I should start?
If that was the case, I'd settle the matter myself. You could talk to our local gossip, Harriet Jones. Not a pin drops here without her hearing about it.
I'll meet that woman now.
My life, as others know, is in your hands, Dr. Reed. I'm sure of your discretion, but I do fear your powers of persuasion will be put to the test. When this is resolved, I'll be your obligé. I'll answer all questions in regards of your...
Yes. Okay. Okay. So yeah, definitely for money. But it's funny how even 100 years ago, during the pandemic, people were still trying to make profit, trying to do stuff.
Bred with no respect.
Hello.
What is this? Who are you? Get out of my room.
There's no need for alarm, madam. I'm Dr. Reed, the new surgeon.
Preposterous. Dr. Reed, you say? I don't want some bumbling intern. Where's Dr. Swansea?
Please, calm down, madam. I assure you that I am highly qualified. I'm just back from war duty.
How brave. Threatening an old defenseless woman.
Wow.
You know how long I've been a patient here? You've picked the wrong fight.
I didn't. I was one.
Harriet Jones? Indeed. I've been meaning to have a chat with you. You know what goes on here better than any other patient, I gather.
Oh, better than any patient, nurse, or doctor. I've seen so many vile undertakings.
I heard there have been some despicable goings-on. Was there a case of blackmail?
Blackmail? Wait. You're investigating something. This isn't a social call. One of those incompetent cunts slit a poor sod's vein.
If I didn't know better, Miss Jones, I'd be inclined to say you enjoy this type of idle gossip.
God's honest truth, Doctor. It's just the way it is here. Most of these bitches would let you freeze to death before getting you a blanket.
Wow.
I assure you, madam, this is not an investigation into a possible medical error.
Debauchery, then? Nurses Crane, Hawkins, Brannigans, whores, all of them.
Wow.
Keep their legs shut. I've seen them scratching slutty sores.
Really? Well, if you have irrefutable proof, I'll not have the staff behaving in such a manner here.
This is your business, Doctor, not mine. But I swear one of the nurses is cavorting with some man on hospital hours.
Thank you for your time, Miss Jones. You've given me something to go on. See you on the next round.
Wait, what? And yes, I just...
The patients and staff might know something. I'll start my investigation with them.
Cool. I'm confused. I thought we were doing about blackmail. Hello. Oh.
You're sure you don't come back with me?
Okay, cool.
No, I have to see someone at the hospital.
Be careful. You look so bad they may keep you as a patient.
Fuck 'em. I don't like hospitals. Or doctors.
Damn.
Well then, when you go back to Whitechapel, you may find this useful.
What is it?
A pass for a free medical exam by the best nurse available. Just read it.
I don't read well, but thank you, I guess.
Damn. Okay, now we going to random mobsters apparently. I dig it. We'll do it. Stools. Oh shit.
He's locked the door behind him. I need to find another way to follow him. This man has been savagely attacked and dragged to the floor.
I would say one. Oh, I forgot to go to bed. Damn. Bite, bite, bite. In this case, unless I. Okay. Money. Right, seriously, how much of a head start did they get? Okay. Oh, yeah. Oh, I can do You cannot breathe. Okay. Hello.
Are you injured, sir?
Help me get out of here.
I'm Dr. Reed, and I'd be...
Okay. I'm Oswald Thatcher. Please, I
Oh,
need to get
Thatcher,
out.
who that?
You're safe.
Gave you memories.
Do you think you can reach the street by yourself?
Yes, I do.
Good. Now leave this place and enjoy the cool night air. It's quite invigorating. I'm sure you'll feel better.
That noise. Okay, cool. Cause that was unexpected. Oh, nope. You would up a street right there, you would think you would be able to. Bang, I can go back too. Yeah, he's not going to ask how I killed them. Oh, rats! Oh wait, the band of the dragon. No rats will harm. I do remember that. Light, generally. Okay, good, nice. Oh, rat! Oh, no blood. Well, no blood might be well. Damn, and they came to. Wait, wait, what?
What sort of creature is this?
Yeah, that's what I want to know. Okay. Feed me! Yeah, I wasn't expecting to face something like this. Now this is more of a nice fight. Hel- I think that's the first hit he actually got on me so far. Wow, this it must have been a half an hour already, but
Here's what's left of him.
whew,
Not a lot to check, but I should anyway.
can I get anything from you? No. Like, jeez. That
Some voucher for a free checkup in Whitechapel. What is Nurse Crane up to? I really must find her.
that one I'm like, wow. Why go? What's the point going to Fasul? That what I'm still trying to figure out. Way too many dead bodies for me to think would be a good idea. But with that, everybody, I actually am going to get in the deal, but get out of here first. Yeah, like, wow. That's just insane. So happy to have you join, and this is Joey G signing off. We'll see you guys next time. Goodbye.